Hello, my name is Charlene Medina and I'm going to teach you a little bit about infertility and some treatments for it. Infertility is defined as the inability to conceive or carry a pregnancy to term after 12 months of trying. It is a condition of the reproductive system that prevents the conception of children. This can be due to the male or the female, although many cases are due to unknown causes. Women who suffer from infertility are likely to suffer from painful or irregular periods, as in they could be shorter or longer or heavier or lighter than normal. Unhealthy body mass index, like being too overweight or too underweight. History of miscarriage and STDs. Infertility affects approximately 10% of the population. Infertility strikes diverse groups, affecting people from all socioeconomic levels and cutting across all racial, ethnic, and religious lines. It has been recognized as a disease. 20% of infertility cases are due to unknown causes. 1/8 of couples have issues becoming pregnant. 1/3 of infertility problems are attributed to women, and 65% of infertile women who seek medical assistance are successful in giving birth. Procedures used to achieve pregnancy are called assisted reproductive technology. There are many different infertility treatment methods, which we will discuss further in detail. Artificial insemination. There are a couple different methods of artificial insemination, consisting of inserting sperm directly into a woman's cervix, fallopian tubes, or uterus. This makes the trip shorter and easier for the sperm. It is used when a couple has a low sperm count or endometriosis or other issues. In intrauterine insemination, sperm is directed straight into the uterus, really close to the fallopian tubes. This procedure is more expensive than the intracervical insemination, which delivers sperm close to the cervix. Intracervical insemination has been around for longer than intrauterine insemination. In vitro fertilization. Other forms of assisted reproductive technology include in vitro fertilization, where sperm and egg are actually combined inside a lab. The most qualified embryos are inserted into the uterus, sometimes more than one. 99% of all fertility treatments use this method. In fact, 1.5% of babies in the US are conceived using this treatment. IVF can help you get pregnant if you have problems with ovulation or egg quality, maybe blocked fallopian tubes or endometriosis, or if your partner has problems with the sperm count or motility. If you're using donor eggs to become pregnant, this might actually be the treatment for you. Gonadotropin, a type of fertility drug that stimulates your ovaries to develop multiple mature eggs for fertilization instead of just one. You also need to take a synthetic hormone to prevent early release of eggs. Gamete intrafallopian transfer. Like most other methods, the sperm and eggs are removed. However, unlike in vitro fertilization and other assisted reproductive technology methods, the fertilization process actually takes place inside the fallopian tube rather than outside in the laboratory. Zygote intrafallopian transfer. Again, the sperm and egg are combined in the laboratory. The difference is that a small incision is made in the woman's abdomen to insert the zygote directly into the fallopian tubes. Frozen embryo transfer. Healthy embryos are extracted and frozen. A woman gets frequent blood tests and ultrasounds to identify the appropriate time in the patient's cycle to transfer the thawed embryos into the uterus. The endometrium must be at its thickest so the egg can attach. Intracytoplasmic sperm injection. This process begins with the collection of sperm. A microsurgery might be needed to collect the sperm directly from the testicles. Egg production is stimulated by the hormone gonadotropin. Then, the eggs are collected with a needle in which is inserted through the wall of the vagina. The sperm is injected into the egg in a glass container. When these become an embryo, it is placed inside the uterus through a catheter.